Hi, hello, good evening, everyone. Welcome to iMumz Ask Me Anything session. We have a very young, dynamic, super talented Dr. Yuvraj Jadeja ji with us. Welcome, Dr. Yuvraj, to iMumz Ask Me Anything.
Thank you.
So we are having the pleasure of having this session twice with you now. So let me take the privilege of introducing to all the audience before we start. So Dr. Yuvraj ji is a fertility consultant, obstetrician, and gynecologist at Akanksha Hospital and Research Institute in Anand, Gujarat. He is very popular for his professional services among all his patients and clients. He is also the fertility incharge and associate professor at Karamsad Medical College, and he is very well known in the community of doctors, for his scientific work. We are very lucky to have him with us today, and especially for the second time on the iMumz platform. Today, he'll be talking about, for the first 10 minutes, he'll be explaining about pregnancy after infertility treatment. And post that, he'll be happy to take all your questions. So please post your questions in the comments section. And Dr. Yuvrajji will help with all of these. So without wasting much time, over to you, Dr. Yuvrajji. Please educate us on the topic for the day.
Good evening, everyone. Thank you, Ravi, for the introduction. And before I start, it becomes mandatory to congratulate iMumz on their wonderful success and, of course, a great job that they are doing. It's just been a few months, I guess. iMumz had started and we did the first live sessions, and it's just become crazy popular, and we are very happy to be a part of it. And Ravi, of course, is a wonderful person doing great work, and I congratulate him on followers and success of the entire app. All right. And good evening to everyone again. The topic that we'll be discussing today is pregnancy after infertility. And it's a very interesting topic because, when you are going through the treatments of infertility, people just read and research a lot of things regarding infertility. And, the moment that day comes when they become pregnant, they think that they are lost because they've never been prepared for pregnancy and they don't know what to do. And then an entire frantic emotion starts of, asking every step of the way, googling every small thing, whether to eat, whether to drink, whether to walk, whether to sleep, how long, what not to do. But interestingly, if I put the entire session in just one sentence, I think I'm one of those doctors where I like to keep things natural. I like to keep patients calm and behave as normal as possible, because I would always say these things, that any pregnancy, be it a pregnancy after infertility or without infertility, is the same. At the end of the day, you're a mother, you're going to carry that child, and the 9 months are going to be same. Even in a natural pregnancy, no two pregnancies are same. Every pregnancy is going to have its ups and downs. So will a pregnancy with infertility. Of course, what changes is a little bit of the treatment, which anyways is the doctor's responsibility, more so. So for a patient, my only and only advice is, you're pregnant and just take care of the medicines, follow your doctor's advice, and otherwise treat your pregnancy as any natural pregnancy. And I think you should be fine. Saying that, most of the time what happens is, after an infertility pregnancy, now infertility divides itself into a lot of treatment strategies, where you can get pregnant after, say, a simple tablets and follicular studies that were done in you, to as different as an IVF, frozen embryo transfer pregnancies. Now, usually the medicines and the treatment is a little different for every one of them. But I think what I'll be trying to cover here is what, as a patient, you need to take care of. And that will be a generalized form of care and treatment that you should be doing on yourself. Because, you might want to know what drug I should take. Should I start progesterone? Should I stop progesterone? How long should you take estrogen? These are all things that anyways your gynecologist or your infertility doctor who's treating you is going to take care of. So we'll be more so talking about what you can do. So the first thing is, if you are in any form of infertility treatment, usually my first advice is don't wait for a week or 10 days for you to miss your periods, then do your testing. Most of the time, especially in our country, there's a trend. They wait for a few weeks because they think that nothing is going to be seen in ultrasound, that they don't immediately approach the doctor once they miss their periods. And that's a very crucial time where you might miss those crucial medicines that are supposed to be probably added in your treatment part. So of course, if you're going to do an IVF, it's going to be a blood test, and that's not going to happen. But this is more so for IUIs and for patients who've been taking simpler form of treatments for infertility. My first advice is, the moment you miss your period, test yourself at home or go to a clinic, test yourself and find out whether you're pregnant or not. If you are pregnant, immediately consult a doctor, check your prescription, and take the following advice that are going to be needed. Now, what are the following advice that are going to be needed is, of course, your doctor might do your blood test, a blood panel immediately when you get pregnant, might want to see your thyroid levels, because these usually infertility is a little delicate in terms of how fast something could go wrong. And it's a fact that infertility pregnancies have a little bit of a higher miscarriage rate. And that's where the first 3 months become very crucial. So one, go immediately to your doctor, get your pregnancy confirmed and your tablets in place. Second, of course, is relax. That's the most important thing. Don't stress yourself out. Most of the patients usually start just going crazy about, can I eat almonds? Can I eat cashews? Can I eat this fruit? Can I eat this vegetable? Can I eat that? Can I eat this? Can I walk? Can I run? Can I climb stairs? Do I need to be on bed rest? All these questions, at the end of the day, if you were naturally pregnant, what would you do? That's the answer. There's nothing different you need to do for an infertility pregnancy. You don't need to lie down for 24 hours. You don't need to stop working. You don't need to go stop moving out. You don't need to eat 10 almonds and 10 cashews and 10 pistachios and 10 this every day. Your diet has to be well maintained. Eat what you like. Take enough rest. The only thing we advise is take it a little easy. Know what your body is telling you. Don't overdo anything. Don't overeat any of the, especially a particular ingredient or whatever that you're thinking about. Now, scientifically speaking, your medicines are very important, because in an infertility treatment, it is usually the medicine that is supporting your pregnancy vis-a-vis a natural pregnancy wherein your body is actually supporting your pregnancy. So your first 8 to 9 weeks of pregnancy, it is only these medications that are going to keep your baby intact. So take your medicines at time. Don't skip those. It's more so after 3 months of your pregnancy that the body kind of takes over from the medicines, because that's when the development of placenta starts. And that's when the hormones that you were externally supplying will be converted, and you won't need them externally. The body will start. Now, when I say that infertility pregnancies are very similar to natural pregnancies, of course, there are differences, a little bit of differences, scientific differences, not in terms of what you need to do at home. The difference, one, as I said, in the first trimester, your chances of miscarriage is a little high, so you need to take care of it. You need to be aware of any bleeding, any spotting, any abnormal signs such as extreme pain. Any of these, do consult a doctor. Don't take your symptoms lightly. 3 months. So these are the first 3 months where you need to really take care of the miscarriage, because, as I again repeat, the miscarriage rates are a little bit higher. You need to do your blood panels, do your scans, diagnose whether it's a twin pregnancy, it's a single pregnancy. Now, very importantly, as again in any normal pregnancy, your 3-month scan would be an important scan, especially in infertility, because you've conceived after long duration of infertility. Most of the time, if your age is a little bit higher, there are chances of abnormality. Now, that's another point that I'd like to address, especially here, is most of the people feel that, when you get pregnant through infertility, they're scared. Is my baby going to be normal? Is an IVF baby a normal baby? Is it going to be as natural as any baby? All right, the answer is simple, yes. There's going to be no difference. There's no difference in terms of your baby, whether it's an IVF baby, a natural baby. Millions of babies through infertility treatments and IVF have been born, and none so ever research has showed that IVF babies are different or are more abnormal. But the only reason we need to be more aware here is, one, you've got pregnant after a long duration, so we don't want to wait one more time or repeat the entire process again, or want to miss something out. And second is, most of the time infertility is associated with longer duration of marriage and a higher age of the mother and father, and that's the reason we need to investigate for abnormalities. Now, second trimester is kind of calm, not much to be done. Just check your cervical length, whether the chances of your preterm are not. Get your scans in place, your anomaly scan and your NT scan, which is a 3-month and a 5-month scan, and you're done mostly. The last trimester again gets a little complicated, because at the end of the day, infertility is something that is a conceivement has happened against the nature. So the chances of preterm deliveries, medical disorders such as hypertension, diabetes, is a little bit higher, and you want to avoid that. So I usually prefer covering your baby with, so you can always ask your doctor to cover yourself with steroids. So steroid is just a one shot of steroid, which kind of covers your baby's lung maturity. Because if in case you have a preterm delivery, these injections or shots of steroids will help your lung to mature faster than they would have, and might save your baby. You need to again take care, take it easy in the 9th month. If you have any medical disorders, if you have any placenta disorder such as a placenta previa, or any kind of, or you have a previous history of a lot of miscarriages, you need to do your Doppler scans, your growth scans, increase your frequency of visits to doctors in the last trimester, get yourself evaluated, and discuss the birth plan with your doctor. That's something that again is very important in terms of infertility. And I'm one of those believers. Of course, natural is always better, but I believe, do as your heart says, do what you want. Nothing is to be forced upon in terms of delivery. So you can take your options. It could be a vaginal delivery, it could be an epidural delivery, it could be a C-section. Know the pros and cons with your doctor and decide accordingly. um I think we can take questions now, Ravi.
Thank you so much for explaining in such a simple and a profound way, and stressing on natural and holistic methods, doctor. That's very, very helpful. We have so many questions. Many people want to speak to you. First, Shreya Malhotra. She is facing colitis problem, and she is planning to conceive, uh, and she needs help. She's asking for your advice.
Oh, so Shreya, you said, right?
Yes.
See, colitis uh, is a very generalized term. So basically, colitis, Shreya, means that your colons, that is your intestines, are inflamed. Now, if it is a chronic colitis, which would mean whether it's an ulcerative colitis or a severe variant of colitis, then it is something that needs to be discussed with your gastroenterologist. Because in case of ulcerative colitis, the medicines that you're taking, uh, maybe you could be on steroids, maybe you could be on some kind of antibiotics. So if you're planning to take just to put it in a simple way, I don't think there's anything that is there's any advice that is against you taking a treatment for infertility. But you need to check, I think the most important is you need to check your list of medicines. If those medicines are kind of aligned with pregnancy, or are they going to cause any harm in the pregnancy, you need to change that. Of course, you need to be in a very remissive phase. You can't have an acute colitis and then just decide to go for IVF. You need to bring yourself into a remission phase. When I say remission phase, means your disease is not active, it's slowed down, you're stable enough, and then of course I think you can get pregnant.
Thank you so much, doctor. Wish you all the best, Shreya. Next question from Kalyani. She's in 35th week of pregnancy, and she wants to know if the baby, when is the baby ready for the labor?
A baby, when it's ready for labor, will let you know, Kalyani. There is no way in the world uh, any doctor or any mother or anyone can tell you when the baby is ready for labor. I think the only way you can, I think the only thing I'd like to tell you here is some signs where you would know that you're going into labor. So one is that you'll start getting pains, and pains that is going to keep on increasing in duration and in intensity slowly and slowly, not just going to go away. That'll The second one is you might have some bleeding, you might have, if you have leaking, and that's it. Otherwise, there's no way you are just going to know that tomorrow you are going to be ready for labor. If you've crossed 38 weeks, your scan is normal, you have a good the AFI is normal, and your Dopplers are normal, post 38-week pregnancy, you're ready anytime. But you will never know when you'll go in labor. You might be 38 weeks, 39 weeks, 40 weeks.
Thank you so much, sir. Next question by Mahima Goel. She's in 27th week of pregnancy and she's having gestational diabetes. Her doctor prescribed a diet. Please tell what particular diet should she follow? She's having gestational diabetes.
All right. So, gestational diabetes is diabetes that comes in pregnancy and probably goes away. What diet you should follow? As you said, your doctor has already given you a diet. I would just say follow that. What instructions I'd like to give you is, one is, of course, check your sugar levels regularly. I don't know whether your doctor has put you on some kind of medications or not. If not, that's a good sign, because the doctor thinks that you don't have the diabetes severe enough that you need medication. So mild forms of gestational diabetes, usually with strict diet control, are under control. And when we say strict diet control, of course, it goes without saying, it means no sugar. And at the same time, it means taking less of vegetables and fruits which have higher glycemic index. So when we say glycemic index, that means food that is going to give more glucose in your body. So for example, fruits like banana, potato, a lot of people have corn. These vegetables and fruits have high glycemic index. So the best way is, don't go on Google and search every ingredient that you're going to eat, but decrease your wheat and rice a little bit. At the same time, decrease fruits with higher glycemic index, increase your green vegetables and your fibers. And I think you should, of course, any added sugar is to be totally avoided. And I think you should be good to go. The only advice I always want to give to gestation diabetes patients is, usually what happens, you need to maintain a balance. These patients usually get scared and start eating less. And eating less is not your answer, because you are at 27 weeks. These are very important weeks where your baby needs a lot of nutrition. So eat right and eat good amount, but the right things. Because don't starve yourself. A lot of times people just, when you say stop eating a lot of carbs, people stop eating rotis, people stop eating rice. You don't need to do that. Control your portions. And I think there's another easy way. There are a lot of information available on the net. At the same time, I think you're on iMumz app. I think they have you have good diet options. They give you a lot of advice. I think they would have credible dietitians in their forms. So it's always better to have someone guide you through that.
Thank you so much, Dr. Mahima. We have diet chats week-wise inside the app. You can just have a look. And I hope you're following your week-wise recommended meditations and music schedule and baby bonding program as well. Next question from Vasundhara. She's 37 weeks pregnant and she's in her term scan. AC measure is 30.2 centimeters corresponding to 34 weeks second maturity, and her AFI is 20.2 centimeters. What can she do for AC? She's asking.
Unfortunately, you can't. You are 37, if I heard correctly, 37, 38 weeks pregnant. There is nothing you can do regarding your abdominal circumference. But the only thing I'd like to tell you is that, go a scan behind. uh, Look at your scan that was probably an earlier scan, maybe because you're 38. I'm sure one was done at the ninth month, which is around 32, 34 week scan, and see what was the abdominal circumference and if it was more corresponding. Because you see, last trimester scans and third trimester scans usually have a lot of variation. So, the more early the scan, the more precise they are. So when you do your first scan and it shows, okay, your baby's growth is 7 weeks, then it's actually around 6.5 to 7 weeks. When you do a second scan, that is in the second trimester, the variation increases. It almost becomes around, plus or minus 2 weeks. And when you do a third scan, the variation is even larger. It becomes around 3 weeks. So if your weight is normal, your AFI is 20, which is a little bit on the higher side, but you're almost it's time for your delivery. I don't think should be an issue. The only thing I would recommend is ask your doctor whether you are suffering. Most of the time it's mentioned in the report. If anything mentioned such as IUGR, which means there is a growth restriction, your Doppler studies are showing some abnormality, then I think it's time for you to deliver. Don't wait around more. But if all your parameters are normal, which is the Doppler, the growth of the baby in terms of the chart, it's never a one point finding. You always there's always growth charts that are attached with your scans if it's a proper scan. Then I think you don't need not worry too much. But if Dopplers, that is your blood flow to the baby, is somewhere hampered, if the report mentions some kind of growth restriction, especially asymmetrical growth restriction, then I think you need to plan your delivery now. Don't wait around more. If everything else is normal, you can't do anything for abdominal circumference, unfortunately. All you can do is stay vigilant.
Thank you so much, Dr. Vasundhara. I see you're a part of baby care program already. So we have so many guided audio exercises which will help you prepare for your natural and normal delivery at this time. And she also has a follow-up question, doctor. Early scan AC measurement is 23.4 centimeters, corresponding to 27 weeks pregnancy and 6D maturity in 28 week of pregnancy.
So in 28 weeks, that means your scan was corresponding. So I see. Agreed, your abdominal circumference is a little less. It should have been more. You can't have a 38 weeks gestational age and a 30 week, if I remember correctly, abdominal circumference. Either it's an error or there's actually some kind of a growth restriction. So if it's a very recent scan, I think you should get one more scan done, properly evaluate it and discuss it with your obstetrician. Because if it's going towards IUGR, so basically what is happening is, if there is a growth restriction, means your baby is not getting enough food inside, to put it in a very simple language. So then it means that you need to take it out early, because then only if the baby is out you can help it. If it's inside, you can't do anything. So if there is a big lag now, get a scan done, reevaluate it, and talk to your doctor. Do a Doppler study, and if everything is normal, the doctor says fine, then you just wait for your natural labor. But if there is an issue in any of these parameters, you should plan a delivery.
Thank you so much, doctor. We wish you all the best, Vasundhara. Next question from Nazia. इनका सवाल डॉक्टर, एंडोमेट्रियोसिस है, 3 बार इन्होंने आईवीएफ करवाया, फर्स्ट टाइम इन 2017 एंड 23rd वीक शी हैड अ प्रीटर्म डिलीवरी, दूसरी बार 2019 में एम्ब्रियो ट्रांसफर किया, 24th डे को अबॉर्ट हो गया एंड रिसेंटली 16 नवंबर शी हैड दिस एम्ब्रियो ट्रांसफर. अनफॉर्चुनेटली 8 दिसंबर को हेवी ब्लीडिंग की वजह से अबॉर्शन हुआ है. ऐसा कौन सा रीजन है फॉर द रिकरेंट प्रेगनेंसी लॉस? एंड डॉक्टर ने अब उम्मीद छोड़ दिया है, तो मैं फिर से आईवीएफ के लिए ट्राई करूं कि नहीं करूं?
Nazia, I mean, we are sorry to hear that you had so many abortions, but see, recurrent pregnancy loss there is a wide range of reasons जिसके कारण वो होता है, and you do fall into that category because you've had 3 losses. जिसमें one is, I think I can see your message, 2 बार hysterolaparoscopy हुआ है, मैं 29 years की हूँ, right? So you've done hysterolaparoscopy 2 times, you've done IVF 3 times. The only thing I'm going to say is there's nothing called losing a hope. There are a lot of options. The good part is you've conceived 3 times, which means you have the ability to conceive. Your only problem is to continue the pregnancy. So if your hysteroscopy, laparoscopy is normal, I'm guessing because you've had pregnancies all 3 times, and one is what you need to do is, what I was trying to say is all your hormone panels are normal. So agar 3 baar hua, I'm sure your doctor has checked your thyroid levels and your sugar levels and all those things, because वो सबसे common चीज होती है in terms of miscarriage. उसके बाद एक बहुत important चीज होती है आपका genetic evaluation, which means that yours and your husband's genetic evaluation is done, which is one of the causes. If कहीं पे कुछ गलत है तो abortions ज़्यादा होते हैं. But your first abortion was at 26 weeks. So uska reason is very important. Was it a preterm labor pain, or do you have a cervical insufficiency? Matlab your uterus, आपकी uterus का दरवाजा जो था वो loose, cervix is loose, so that so we might have to take a stitch. You have to do, there is एक पूरी list of panel investigations आती है recurrent abortion की, to find out what is wrong. And I think if you need to go now, I don't know who you were consulting. I'm sure he or she was a great doctor, but if it was not particularly an advanced fertility center, you need to go to an advanced fertility center now, because this will require more detailed history, investigation, and care in terms of your pregnancy. But you've conceived 3 times, so you surely can conceive. Your uterus has conceived 3 times. The abortion part can definitely be taken care of, and there are a lot of options. It's just not about give up जैसा तो कोई word आता ही नहीं.
Thank you for that assuring advice, Dr. Nazia जी. हम होप करते हैं कि आपके साथ जैसे डॉक्टर युवराज जी बता रहे सब अच्छा हो. All the very best. Next question by Tashi. She want to ask about normal painless delivery. Is it safe or not?
So normal painless delivery, मतलब अगर normal vaginal delivery की आप बात कर रहे हो, of course it's safe. It's extremely safe. Painless delivery मतलब there is एक सुई आती है, so called. It's an injection that is usually given in your spine, जहाँ पे medicines are administered throughout your labor so that you don't feel pain. There is nothing not safe about it, and you only need to have someone who knows how to give that injection, which is known as an epidural anesthesia. And in fact, that is what most of the people these days do in terms of vaginal delivery. And yeah, it's safe. Keep it simple.
Thank you so much, Dr. Yuvraj. Next question, Karishma. She have done 2 IUI, but then conceived naturally with basic PCOS medicine. Now she is 11 weeks pregnant. Reports are okay. What are the risk factors and how to take care further?
Yeah. So great, Karishma. You've conceived. You're 11 weeks pregnant. You've almost crossed your third trimester. Your first trimester, 3 months, and usually that's the most dangerous period to cross, especially in PCOS also. Now what you need to take care is that, one, I don't know whether so there are some drugs for PCOS such as metformin, N-acetylcysteine, अगर आप continue कर रहे हो, so I prefer continuing them. There are some doctors might want to stop them after 3 months. I would advise you continue them because there's no harm. It will also keep a lot of things under check. Second is the risk factors that you're talking about is patients with PCO will have one very high risk of getting gestational diabetes. So get yourself checked around 24 weeks, especially जिसको हम fasting sugar or postprandial या OGTT test बोलते हैं. So there is a glucose tolerance test, especially for pregnant females. get yourself evaluated for gestational diabetes because you're at high risk of gestational diabetes. Second, you're at high risk of a little bit of pregnancy related hypertension, so keep your blood pressure measurements and uh, under check, and keep checking that. And what you can do, of course, is one, to avoid all this, control, पहले से ही control your diet, keep your diet diabetic diet जैसे आपको है और आप take care कर रहे हो. At the same time, keep your diet a hypertensive friendly diet, which means that low salt, low oil, low sugars, and I think you should be fine.
Thank you, Dr. Karishma. I hope you're following iMumz app as well, जिसमें बहुत सारी चीज़ें आपको दी हुए उस पर्टिकुलर वीक ऑफ प्रेगनेंसी के लिए. ऑल द वेरी बेस्ट. Next question by Chetna. She's 22 weeks pregnant and she's having pain in the lower left side of lower abdomen. Is it normal?
Chetna ji, most of the time it's normal until and unless it's वो dull stretching aching pain अगर है, so it's absolutely normal. A little bit of pregnancy exercises and stretchings is all you would need. And I keep forgetting, but iMumz also would have all these options in terms of yoga, stretching, exercises. This is more about your pregnancy, and so there's nothing to be worried about. But it might increase if you don't start working out a little bit.
Yeah. Thank you, doctor. Yeah, as you suggested, we do have different yoga sessions which are suggested for each stage of pregnancy. Chetna ji, you can check them out. Sandhya, is it safe to do tubectomy immediately after C-section? Her doctor is suggesting to wait for 2 years.
It is absolutely safe. The doctor might be suggesting you to wait is because probably if this is your first pregnancy, or I don't know, maybe it's a second pregnancy, but usually we ask you to wait is because your child is just delivered, so if you have, maybe especially if it's your first pregnancy and you want to do that, it's not advised because God bless every child, but something might somewhere go wrong in a newborn, and and then once your tubes are blocked, you are perfectly healthy to carry a natural pregnancy second time, and you might lose that chance, and then it becomes a little difficult. At the same time, if it's a second pregnancy, at this still, if you wanted 2 kids, your second kid is smaller, and if sometimes it's always better to wait for some time and then do it after maybe a year or two, because you might change your mind. So, and abhi, it's very easy to do family planning operations. It's very simple procedures, so you don't need to do it with cesarean section. But if you want to do it, it's absolutely safe. Issue safety का नहीं है. Issue is more about the social angle of it. कि hopefully your baby remains fine या कुछ हो जाएगा तो फिर वापस आप infertility के चक्कर में आ जाओगे.
Thank you, doctor. Shalini's question, she's 12 weeks, 55 days pregnancy. She conceived naturally, placenta posterior grade 2, low reaching but not covering os. What does that mean? Anything to get worried about?
Yeah, Shalini. So, low reaching placenta not covering the os, matlab, आपका placenta is lying near the cervix. Usually, if it covers the os, matlab wo placenta previa hai, which is a dangerous situation to have in pregnancy, and which will only and only lead to a cesarean section and a lot of taking care in the third trimester of pregnancy. So when it is just reaching the os, meaning just reaching the opening of the cervix, then usually it's not a problem, because the more your uterus will start growing, it will be pulled up and your placenta will reach a normal state. So you don't need to worry about anything. The only thing that might happen initially is you might have some bleeding, or आपको already हो चुका होगा, या अभी भी till 18-19 weeks एक episode of bleeding आ सकता है. That's the only worry, and you need to take proper care for that. But once you'll cross 20-24 weeks, 99% your placenta will move up, because अगर uterus बड़ा होगा तो वो low lying है तो वो उसके साथ ऊपर ही खींचेगा.
Thank you so much, Doctor. Next question. Yeah, Ankita Singh's question: what is the right time for the color Doppler test in the third trimester?
There is nothing like a right time for a color Doppler in third trimester. Usually, the a third trimester scan is done at around 30 to 34 weeks. So उस time पे तो you have to do a color Doppler. Otherwise, you can also do it at any time. जब भी आप scan कराओ, after 28 weeks, whenever you do a scan, usually a Doppler is seen. A normal ultrasonologist, your sonologist will do check your Dopplers. But third trimester, mein, immediately when your third trimester starts, you need to do a Doppler.
Thank you so much, Doctor. Next question from Kumar. She's 20 weeks pregnant and constipated. She's asking for remedies.
So yeah, so constipation in pregnancy is quite common because pregnancy the hormones of pregnancy usually slows your systems and intestines a little bit, relaxes your smooth muscles. So constipation is very common. I think the best remedies for constipation is natural remedies. That is, one is, I think again, apps like this will help you in giving recommendations. Your diet, take a lot of fiber, take a lot of water, and water and fiber usually combined have uh, good effect in treating constipation. At the same time, decrease foods that cause constipation, like a lot of fat and caffeine, coffee, and all those stuff. Personally, I recommend warm water with a little bit of lemon. Warm water usually gets your intestines moving in the morning, or else some people also recommend ghee with banana and milk. So a lot of remedies you can do that. Agar fir bhi diet se nahi ho raha, of course you can, if you're constantly resting because of pregnancy, move about a little bit, do your breathing exercises and do a little bit of stretching and exercises. It will help start your system move. And kuch bhi nahi chal raha, start, if you need to start with medicines, then isabgol is very safe in pregnancy and a natural laxative. Or else syrups bhi aate hai, laxative syrups that you can use, but that be your last option.
Thank you so much, Doctor. On this note, I would like to ask you a question. So you suggest all the holistic, lifestyle during pregnancy. So how important the mental health is, and how should someone go about it, and how important it is for a woman to bond with the baby during pregnancy.
I think you know we have been very fortunate. Hamari generation, the doctors of my generation, I think we have been very fortunate in terms of we have seen the transition. Like very senior doctors, so obviously they were believing because they didn't have these technologies and everything. And when there was a time in between where these things had got lost, and now we are seeing everything come again. But now the difference is that all these recommendations of wholesome health, you know, mentally connecting to your baby and everything, now is backed with scientific research. पहले it was वो पुरखों की knowledge की तरह आती थी in terms of advices, and then we lost it, and now all those advices are coming back with scientific research. So honestly speaking, mental health in pregnancy was very बहुत neglect होता था, and now it's become one of it's a very very important subject. People take counseling in pregnancies just to go through the difficulties, and or probably just to enjoy your pregnancy more rather than just worry about it, connecting with the baby. We have had thousands of examples in our literature about how those characters used to connect with their babies, but we still didn't believe in it. And now we know that the baby can hear sounds. We know scientifically that baby reacts to these sounds and vibrations. We know that what effect it has on different sounds have on the development of the baby, the development of a baby's brain, the connect with the pregnancy. So yeah, I mean, apart from a topic which was just about believing, now it's more also about science, which is great. So and believe me, patients love the experience. I think Ravi would be a better person who would have feedbacks from lakhs of female who have been using all these methods through guided people in apps and have had wonderful experiences.
Thank you so much, Doctor. And that's a great point you have covered. Now, it is scientifically proven that what the womb environment has an impact on the baby's health, happiness, brain architecture, everything. And we are also fortunate to see, many instances women those are following the guided meditations recommended in their week of pregnancy, the music they are listening. The babies are responding to the music. They're calmer. They're more energetic. Mothers are also feeling the difference. One mother recently shared that she took her baby for vaccination. The doctor gave the vaccine, but the baby didn't cry, just gave small squeak, and the doctor was surprised. In his career he didn't see such calm babies. So it is coming out, and mothers are also with these following these things, the perceived stress is much lower, and they're able to consciously enjoy the pregnancy much better.
You know,
So
I think I'll share a very nice experience here, Ravi. So I think it was 2012 or 2011. I was still a student when I was doing my gynec residentship, and so Garbh Sanskar was this new thing that had come up. I mean, it was there since ages, but it was just catching up. And usually, us time pe jab, when mothers used to say that, I sing to my baby at night and I talk to my baby, and they used to connect something. Most of the time, even the doctors used to feel, like, well, this is just coincidentally kuch ho raha hai. So I remember it was 2 o'clock in the night, and a very important VIP patient of my teacher. I was monitoring the patient. She was supposed to be taken for a C-section the next day, and जिनकी डिलीवरी हुई है या लास्ट ट्राइमेस्टर में है कुछ, there is a machine known as NST. So NST is a machine जो बेबी की हार्ट बीट्स रिकॉर्ड करता है in a graph. So because it was my teacher had told me कि रात को जाके एक बार हार्ट बीट्स चेक करके आना. So I took the machine and I went to her room and I was checking her heartbeat, and the baby was restless. मतलब baby की movement इतनी, it was crazy movement the baby had. So NST में तो आपको वो probe बाहर abdomen में, you have to put it at a place which is near to a baby's heart so that it records. Now that baby was moving so much that usually 10 minutes तक recording होता है. So वो 10 मिनट तक तो बैठ ही नहीं रहा था baby. It was moving and it was kicking, and then the graph was not coming nice. And the mother was looking at me, and the mother said, what, the movement is not letting you do? So she said, but the movement is a good. I said, yeah, the movement is a good sign, but this is too much of movement, and we'll not get a graph. It's okay. The baby is active. So she said, no, wait, you want a graph? I said, yes. And so uh, she was from Kerala. So she started singing Malayalam ka kuch gana. It was a very soothing. I think it was a Malayalam folklore or something. And believe me, within minutes the baby calmed down. And it was I was just a new gynaec, and I was so surprised. And I said, what did you do? I'm still surprised while talking about it. That experience gives me chills. And she says, I sing to the baby every night, and whenever he or she gets restless, it was a he ultimately, I sing this song and the baby calms down. That was my first experience years back.
wow, that's thanks for sharing such a beautiful experience, Doctor. It's very glad to know this experience. Next question we take from Teju. She's 16 weeks pregnant and she have done her double marker test and NT scan. The baby in NT scan is good, but double marker, the risk of trisomy 21 is 1:664. She's worried about that risk.
No, did you say 16 weeks?
Yes, 16 weeks.
Okay, there is some mistake, because double marker is to always happens Tejuji between 11 to 13 weeks. 16 weeks पे double marker नहीं होता. अगर 16 weeks पे double marker किया गया है, unfortunately, then it's not right, and it will not give you a, that मतलब there's no point. So that result doesn't matter. Usually 16 weeks पे triple marker या quadruple marker होता है. Mostly it's a quadruple marker, and in that quadruple marker, so I'm assuming your doctor has done the right thing. It is a quadruple marker. Maybe you're just saying it's a double marker. अगर quadruple marker में downs का ratio 1:600 something आया है, usually it's a moderate risk. So you can see report में लिखा होगा कि intermediate risk है, high risk है, low risk है. Markers की report ऐसे ही होते हैं. कभी it will never say that it's a normal 100% कुछ नहीं है. So low risk and moderate risk usually we don't do anything. High risk, of course, हमको आगे tests करने पड़ते हैं. But again, moderate risk, I think 1:600 is somewhere moderate to intermediate risk. अगर moderate to intermediate risk है and still you want, it's your choice. If you still want to be sure and it's only downs that is your worry, then there is a test known as NIPT, which is a non-invasive prenatal testing. NIPT, please note it down. It's a very simple test. They take your blood again, a little bit costlier than triple marker, but they take your blood and they check specifically for certain chromosomal diseases and Downs especially. उसमें Downs अच्छी तरह rule हो जाएगा. That is one easy option. Second, 100% confirmatory option is फिर आपको amniocentesis कराना पड़ेगा. And then you will have to do it quickly because you're already 16 weeks. But if it's only Downs, NIPT will do. And I think it's not a double marker. It should be a triple or quadruple marker. If it's a double marker at 16 to 17 weeks, then you need to do a quadruple marker. This report is not valid.
Thank you so much, doctor. We wish you all the best, Tejuji. Next question from Anvisha. She's 28 weeks pregnant. She's experiencing pain in the pubic area while trying to shift sides and changing positions. Is it normal? What can she do to reduce them?
Anvesha, yes, it's absolutely normal. It's something that everyone will experience in their pregnancy. Again, as we discussed earlier, what can you do to reduce the pain is you need to you need to take help in terms of your little bit of stretching, physiotherapy, exercise. That's the only thing that is going to reduce these muscular pains that usually are increased during pregnancy. And as we said again and again, you can go to the app. You might have proper people who will guide you, and you might have features that will tell you what to do, what exercises to do, what stretching to do, what yogas to do, and it will help you definitely. But nothing to worry.
Thank you, doctor.
Can I travel in this situation? Yeah, I mean, usually we ask you to avoid traveling in the first 3 months and then the last month. Otherwise, yes. And I don't know what kind of a travel you're talking about. A simple short duration travel is absolutely not a problem unless you are comfortable, of course. Hi, so I'll read. Tanya, hi Tanya. So today started 5th week. My ET on the 10th December and on the 21st December, my beta HCG was 860. My ET was on the 10th December and my beta HCG was on 24th December, which was 860. I'm feeling nausea. Please guide me regarding precautions as this is my first pregnancy. Oh, absolutely. Your 860 is it's a wonderful count. I mean, you should relax, be happy, and just take it easy. Of course, as I said in the first part of this talk, that I'm sure you have, consult your doctors. Just take your medicines in the right way, whatever needed and changes to be done post your confirmation of pregnancy, and go for your scan, and I'm sure you'll have a wonderful heartbeat there. Make sure that your thyroids and hormone levels are under normal, because that's the first thing you need to take care when you get pregnant in your infertility pregnancies, that your thyroids are under control, less than 2.5, your sugars and prolactin levels under, because these are very small things that you might miss. Otherwise, you're absolutely fine. Congratulations.
Thank you, doctor. Congratulations, Tanya. Next question by Priya. She's 25 weeks pregnant and she have a cough mostly during the night. One of the doctors suggested to drink hot water with honey and dry ginger powder, but that's not helping. Should she take any medicines? She's asking. 25th week of pregnancy.
25th week of pregnancy and cough at night. I think if it's not medically related, मतलब कोई infection या nothing of that sort. If it's just a general cough, then probably also it could be your because your uterus grows larger, and when you sleep in a supine position, you might try to sleep in a left lateral position. That might maybe help you with cough. And otherwise, I think, yeah, your do your inhalations, do your I think the remedy that someone has given to you also is fine. Soothing pills or something you can take. And of course, if it's bothering you, it's always better to get it checked, because you just make sure that it's a dry cough. You don't have expectoration, matlab, that those pus like thing that comes out with cough. Agar something like that is being accompanied with cough that is causing a lot of breathlessness, you definitely need to go and check. If it's just simple, not causing a lot of problem, it's just the cough, dry cough, then probably we'll go with these home remedies.
Thank you, Doctor. Surbhi Chaudhary's question is
Surbhi, C-section डिलीवरी के
C-section
6 months कंप्लीट हो गए, अब भारी सामान उठा सकते हैं क्या? बेबी is 3.9, 8.5. Oh, definitely. 6 months, you're normal. Just go ahead and get back to your routine.
Thank you so much, Doctor. Congratulations, Surbhi ji. सुरभि जी, I've noticed your questions. आप काफी टाइम से iMumz आप यूज कर रहे हैं, सवाल पूछ रहे हैं. Thank you so much. Swapna's question: she's 22 weeks pregnant and she had her cervix circlage. What are the precautions should she take? Is she on risk?
Well, if you have done a cervical encerclage just as a precautionary encerclage, you're not really uh, that big or risk. But if you have done it because आपकी cervical length कम हो रही थी, or else if you have had a previous history जहाँ पे your deliveries had occurred preterm and were early, and because of which a cerclage has been taken, definitely you are at when I say risk, a little bit of a higher chance that something like this might happen again. So please definitely take it easy, take enough rest, avoid any kind of strain, heavy weightlifting, and travels, of course. And keep checking your cervical length in ultrasound continuously and periodically, so you know that you're okay or not. And you'll catch, if something is wrong, you'll catch it early. Gaurav Arora says, my wife got detected subchorionic hemorrhage at 6 weeks. It is also detected at 10 weeks. Gynaecologist will disappear. She's conceived in the second attempt. Yeah. So if it was at 6 weeks and it is still there at 10 weeks, it will slowly resolve and dissolve itself. If you're not having any kind of bleeding, your baby's growth and heartbeat is normal, just forget about it. Don't stress over it. You'll be fine. Lavanya had a history of miscarriage at 17 weeks. Now she's 11 weeks pregnant, but the coming week I'm going to have cervical circlage. For doc consultation, I have to travel 2.5 hours. And again, 2.5 hours to return home. So I'm worried, is there any trouble in traveling so much long distance for doc consultation after cervical encerclage? No. If you're just worried that cervical encerclage ke baad aapko 2.5 hours you'll have to travel to get back to your home, I don't think you should be worried about that. Get your cerclage good, get admitted early in the morning, get your cerclage done early in the morning, request your doctor if you can, and rest enough for the entire day and leave in the evening. Should not be a problem. Sushma is, hi doctor, will possible normal delivery have polyhydramnios? There's something wrong in that question, Sushma. So, hi sir, I'm 37 weeks pregnant. AFI is 19 centimeters at 32 weeks. In my scanning report mentioned as all are normal. Little bit increase will be possible from, okay, understood. So it is. There's no contraindication that just because your AFI is 19, you will not be able to do a vaginal delivery. There are certain things that that will need it to be taken care of. But the only important thing here is just rule out, because of the polyhydramnios, that you're not suffering from some latent diabetes which has not been diagnosed, and your baby's position is normal. And you're 37 weeks, I'm sure if evaluation ho gaya hoga, your baby head is down, fixed, and your pelvis is normal, you can definitely think of a vaginal delivery. Not a problem. You can try.
Thank you so
But
much, Doctor.
saying that, I would definitely say don't kind of force yourself कि बस वही कराना है. If there's something that your doctor feels is, it's also आपकी comfort के साथ साथ, it's also very important that your doctor is comfortable in doing that particular thing. Because at the end of the day, you both have to be on a common page and you both have to be happy of what you're doing. If your doctor feels that in this, I might do it, but if your doctor feels that 19 centimeters in his or her experience, it is always better to go for a C-section, please listen. Because at the end of the day, it is a doctor's comfort and decision also that matters. You can always discuss with them and then take a call, but don't be adamant, because anything is fine here.
Thank you, Doctor. I think that's a point to note for everyone. Thank you so much for that clarification. One last question of the day. Pragati's question, she's 28 weeks pregnant and she have fibroid and placenta position in posterior. Doctor says it's high risk pregnancy. So is it possible to have normal delivery? And what does it mean by high risky? And what are the complications in this pregnancy?
So Pragati, I'll tell you the exact same thing that I told in the last answer. But okay, so of course, एक तो what is the size of your fibroid? That is very important. एक छोटा सा fibroid posterior wall पे है with a posterior placenta is not a big issue. It's absolutely all right. High risk, because it's a fibroid, you might call it a little bit high risk, but it's not. इतना tension लेने की जरूरत नहीं है. Things will be fine. A lot of females have fibroids and everyone gets pregnant and gets delivered. Normal vaginal delivery is definitely possible. The only thing that the complications or high risk that they are talking about is, one is sometimes the labor pains with a fibroid uterus is not adequate. Second is delivery ke baad bleeding ke chances, so postpartum hemorrhage, the chances are a little higher. The baby's position might be a little awkward because of the fibroid. It might not be in a normal, so what we call as malpositions and malpresentations might be there. So there are a few risks involved, but most of the time, saying that, don't get scared, most of the time these pregnancies are uneventful, but it will depend on the size of the fibroid and exact position of the fibroid. If it's very big fibroid, yes, your doctor might be more comfortable with a C-section, but if it's a small fibroid, and when I say small, matlab 2 centimeter, 3 centimeter ka fibroid hai, it will not cause you any problem. Just relax and you can definitely think of a vaginal pregnancy. Again, discuss with your doctor, and it's very important that your doctor is comfortable doing what you want.
Thank you so much, Dr. Yuvraj ji, for your presence and time. I know that there are so many questions still left, but we're unfortunately ran out of time. Please post all your questions inside the iMumz app, and one of our doctors will definitely answer your questions in the feed section. And also subscribe to the Baby Care program. We have more than 500 plus activities designed for your health happiness, and your health happiness creates a very safe womb environment, like Dr. Yuvraj was saying, and that will make your baby healthier and happier. And this is the right time for you to invest your time in the health and happiness of your baby. There are guided exercises for each of your weeks of pregnancy, so please check that out. Shreya, colitis problem, I think this was the first question we took. You can rewind the session and watch it. Your question has already been taken. So thank you so much, everyone. So those questions will have, please ask in the iMumz app. And said today's 175th Ask Me Anything session. You were there in the, I think, first 5 episodes. In one of the first 5 episodes, you were with us. So again, it's lovely having you back. Thank you so much. Thanks for your time, and keep. We would love to see more of your sessions in the future as well.
Yeah, thank you for having me, and keep doing the good work that you're doing. And we are all here. And again, I congratulate you on this amazing success for iMumz. It's really, really nice.
Thank you so much, Dr. Yuvraj.
All right, Ravi. Chalo, take care. Bye.
Have a great day, everyone.